Welcome to the Population Health Management Podcast, brought to you by Lightbeam Health Solutions. My name is Laurel Derr, and I will be your host for today's episode. Hello. Today we have Jessica Scruton again with us. February is American Heart Month, and we wanted to get on the podcast to talk to you a little bit about heart health. Jessica is a registered nurse with CCM certification and is an advisor on our clinical transformation team here at Lightbeam Health Solutions. Welcome, Jessica.
Hi, Laurel. It's good to be here again. I've so been looking forward to this one.
Yeah.
Hearts are it's my passion.
Your jam.
My jam. Before I got into care management, I did cardiovascular ICU nursing for 10 years. Heart and lung transplants, open heart surgeries. I saw all of the patients that had gotten to the point that they were so sick that it was too late. Before I worked in care management and population health, I worked in the CVICU, so I was cardiovascular ICU. We did heart and lung transplants and open heart surgeries. So we saw some pretty sick patients. So Heart Month has been always something that is near and dear to my heart.
So why don't you share the story with me that you were telling me earlier about your dad?
Oh yeah, that one's a tough one. Heart problems don't always look like you would expect them to look. And I think that's the big message that we need to get out there today, is that the signs and symptoms, what you would expect your life to look like, how it happens, none of that is a textbook definition of having a diseased heart. And so I think one of the biggest things about Heart Health Month is understanding what to look for, but also understanding how to prevent yourself from getting to that point. My mom and dad have been married for 50 years, so they had this big trip planned last year to go overseas for a couple of weeks to just enjoy themselves and their 50-year wedding anniversary. My dad practices medicine. He has a population of MSSP or Medicare, so he watches those types of patients as well. And he has a nurse practitioner that works for him. And she said, before you go overseas, we need to get your annual wellness visit done. This is very important. And he said, yep. Just like the rest of us, like, oh yeah, no, I'll get it done. Don't have time, busy schedule. And she said, no, we're going to go ahead and get this done. They did his annual wellness visit and saw some stuff on his labs. They took the labs and decided they wanted to do an EKG. So they did an EKG on him, and after that EKG, within 24 hours, he was in the cath lab having a massive occlusion in his heart opened up. So he had a saving grace in the fact that he's on blood thinners previously, so something for him that was not catastrophic would have been for anybody else. And it was like this revelation that all of these things that have been put into place to manage your health, like the annual wellness visits and getting your labs drawn and all of these things are there for a very good reason. And this was the very good reason. So he's doing great. He still went on his European vacation.
Yeah, that's amazing.
And the weird thing was he never had, looking back, I was like, Dad, you had to have known, like this was a massive occlusion in your heart. You had to have felt something. And he was like, well, I did have a little heartburn every once in a while, but nothing major. And I was like, well, the heartburn that you had, like, was it like you normally have heartburn? And he said, well, I don't usually have heartburn. And I was like, oh my gosh, Dad, that's right there is, it's these signs and symptoms that our bodies are trying to show us. You think heart attack, chest crushing pain, or, the numbness down your arm. Yeah, those are all signs and symptoms, but there's minor things too. And if it's unexplainable, or if it's something that doesn't go away with a course of medication that should take care of it, then you've got to go see your doctor. And so that was kind of the segue into why I thought this was a really important topic for February was Heart Health Month, is because we see these things happen, and what we expect to see and what actually happens are not always the same thing.
So what is an occlusion?
Oh, that's a good question. There's different types of heart disease. An occlusion basically means blocked off. So you can have an area of your heart that's blocked off. So that means the arteries are not feeding that part of the muscle with any oxygen or blood or with what it needs to pump. That happens for a couple of reasons. The big ones that we can kind of mention are clots. You can get clots, plaque buildup, so cholesterol. That can build up in your heart as well and cause it to occlude. Or a plaque rupture, which is what happened in my dad's case, which is where the area actually punctured and ruptured and caused this, should have caused a huge clot to form that didn't. That might be a little bit technical, but all of these things, like you hear about, like cardiovascular disease, so high blood pressure, high cholesterol, diabetes, they all play into such important roles in heart health. So yeah, like all of these, either the rupture or the clot or whatever it is, they all have risk factors involved. Those are things that we already know about: smoking, diabetes, obesity, family history, high blood pressure, high cholesterol, low healthy cholesterol, which is also a thing that not everybody knows about. And a lot of these things we have control over, but a lot of them we don't.
Yeah.
So it's important to understand what your risk factors are that you can control, as well as the risk factors that you can't and that are family and you need to monitor and watch for. So it's knowing what you can impact and what you can't. And a lot of it does play into your genetics. We have people that are in our family that are, healthy weight, healthy eaters that have super high cholesterol. That's not because anything they're doing or how they're living their lives. They have a predisposition and it's genetic. Mm-hmm. So types of situations like that you just need to be aware of so you can monitor for it. So it's important to know that you can impact some of it. Some of it is genetic and it needs to be monitored by a doctor, which is why those visits are so important. That's something that we covered in January for the Healthy Living podcast. Mm-hmm. All of those suggestions and recommendations we made are exactly the same as what you would recommend here. I mean, don't smoke, don't drink too much, don't eat unhealthy foods, mm-hmm. exercise. All of those things are what you need to do for your heart. There is a certain amount of exercise recommended, but that's all based off of your physical activity and your skill and what your doctors say are okay. But anything is better than nothing. Mm-hmm. And so getting that exercise in is very important. But we all know that eating healthy doesn't always look the same based off of the condition that you have as well. Your heart healthy diet is mm-hmm. different than your diabetic diet.
Yeah.
For heart healthy, you want to go for complex carbohydrates, low sodium. Mm-hmm. The highly processed foods, you really want to avoid those with heart disease, mainly because of the sodium in them. Sodium is a huge, huge impact on your heart.
I guess for listeners that don't already know, could you list out some of the signs of a heart attack?
Yeah, sure. Again, the most important thing is that don't take this as a checkbox of, I don't have these exact symptoms, I'm fine, I don't need to go to the doctor. Mm-hmm. So the big pieces of advice would be to look for anything that feels out of the ordinary or abnormal. If we really listen to our gut, we know when something's wrong with us. It's just a matter of if we want to hear that or not. Like with my dad, he doesn't have heartburn. He never has. So heartburn that didn't go away with medication for heartburn should have been an indicator that there was something else going on. But for him, he just kept plowing through, going to Europe. So chest discomfort, it's a pressure squeezing pain. It's a sense of fullness. If it's really bad, the term that I've heard many times in the ICU was it felt like there was an elephant sitting on my chest. So it was just this intense amount of pressure on your chest. Upper body discomfort, a lot of it, women tend to have it radiate up into their jaws, but men, you'll see it down that left arm like you see. The other ones, shortness of breath, sweating, nausea, lightheadedness, dizzy, anything out of the ordinary like that. I will say this, the symptoms are directly related to where the heart attack is taking place in your heart. So a blockage in your left main artery is going to look a lot different than if it was in your, a different artery. And the medical staff and personnel are trained to kind of understand the nuances of all of that. On top of that, men and women present very differently. Mm-hmm. So what you would typically see for a man are not the same symptoms that you would see in a woman. They're different. These signs and symptoms, like I said, they look different for everybody. If you're having a heart attack, do not drive yourself. Call 911. Early intervention is key.
Yeah, those are some really great points. One last question I had was how our Lightbeam clients can use the platform to monitor their patients' heart health.
The platform's great because, again, we're pulling in data, analyzing it, and looking for trends, risk patterns, things like that, things that'll predict future risk. So using it to look for patients that are missing annual wellness visits, to get them into the hospital or into their doctors to get those done so they can be like my dad and find out if there's anything wrong. Connecting them with resources is important as well, so they know that if they do have something happen, they have the resources to look after themselves appropriately, like take their medications, go to cardiac rehab, all of those important things. But looking at the data, looking at the risk scores, identifying any chronic conditions or comorbidities, the more chronic conditions you have, the higher risk you are. Mm-hmm. So taking care of those is important. We see diabetes a lot and hypertension. Those are pretty big, prevalent categories of disease that we see. So managing those categories and making sure that they're getting into their physicians and getting their labs drawn and their blood pressures well controlled. Mm-hmm. A big thing that's coming out is the remote patient monitoring, and that's huge. So if you do have cardiac disease, having somebody attached to your EKG so they can look for trends in that, or your blood pressures, heart failure and weights, monitoring those types of things on a regular basis to see any red flags that you could get in there and mitigate any risk of exacerbation before it happens.
So then, if our listeners are looking for more resources on heart health, is there anywhere that you'd like me to direct them to?
Oh, heart.org, the American Heart Association. Mm-hmm. They are an excellent source of knowledge when it comes to heart health and heart disease.
Great. I'll leave that in the description down below. Thank you again, Jessica. This has been a great podcast. I hope all of you learned a little bit of something that you can walk away with. And stay tuned for next month's health podcast.
It's going to be a good one.